Thank you for joining me today for today's video clip, which is all about controlled ovarian stimulation. I'm Dr. Scott Whitten with the Nevada Center for Reproductive Medicine. Controlled ovarian stimulation refers to the act of stimulating the ovaries to produce an egg to ovulate in the attempts of getting pregnant. And there's different goals or objectives when you're trying to stimulate the ovaries. There's a concept called ovulation induction, which is really when a woman doesn't ovulate on her own. You're trying to induce ovulation to occur. So your goal really is only 1 to 2 eggs to grow in that type of a treatment cycle, as opposed to what's called controlled ovarian stimulation or hyperstimulation, which is when a woman's already ovulating and releasing an egg each month. We're trying to super ovulate her, which means attempting to get more eggs to grow in a given cycle. And we do this in different types of treatments, including in vitro fertilization as one type of stimulation, but then we also do it in other cycles where patients can use intercourse or inseminations in order to get pregnant. There's different medications that we would use for patients to induce ovulation for them. There's a couple of oral medications. One of them is called clomiphene citrate. The other one is called Femara or letrozole. Femara is used off-label, which means it wasn't intended to be used for what we use it for. However, that's what we use it for, and we've been using it for probably the last couple of decades with great success. So we use those 2 different oral medications, and then we also use injectable medications. So it really depends upon what's the goal, and then how much medication does a patient need in order to achieve that goal. Now, there are risks when you take these medications. One risk would be that the medication doesn't work, and you don't grow an egg that month. You also could actually overstimulate, which is called hyperstimulation, where you actually make too many eggs, and therefore it would be too dangerous to proceed. These things all can be tailored by monitoring a patient's cycle, so we keep track of how they respond to medications with ultrasound. So typically in our office, we're monitoring patients every cycle, every month, for the response to the medications, and hopefully that we're getting the right response we want and they get the success that they want. Success rates are really dependent upon multiple factors, and therefore I can't quote an actual success rate for just inseminations unless you know other details about a couple, such as what is the female's age, what are their underlying infertility factors, are their tubes open, do they have endometriosis or other conditions. So once you know those factors, then you can talk about what would you expect for the success rate when you stimulate a woman's ovaries to produce eggs. But it ranges anywhere from about 10 to 20% per month. So I hope you've enjoyed this information. If you have more questions about it, please feel free to contact our office and our professionals at NCRM. Have a nice day.